video, I am going to clear up the confusion between celiac disease, gluten sensitivity, and a wheat allergy. What's the difference? Celiac disease, this is actually an autoimmune disease where you lose the villi in your small intestine. These villi are very sensitive to gluten, so if you eat gluten, you're going to have inflammation and cause flattening of those villi, causing problems with absorbing some of your nutrients. We may see commonly a lot of vitamin deficiencies in people with celiac disease, especially. We know there are some blood tests, such as an anti-tissue transglutaminase antibody that you can get done. The most definitive way is to have a scope where they actually take biopsies of any areas that are inflamed. Now, if you have celiac disease, unfortunately, you have to avoid gluten for life. But nowadays, there are so many wonderful gluten-free foods on the market. Now, some signs of celiac disease, you do have to have a genetic predisposition to it. So there is genetic testing to see if you have it, but it doesn't really mean that it's always active. It just means that you may be more likely to get it at some point. Gluten sensitivity is a different type of an immune reaction where your body is making an IgG antibody to gluten because somehow it was exposed to it and it thought it was foreign. So it made an antibody to it. So as a result, every time you eat gluten, your body triggers its immune system and causes inflammation and you feel bad, whether that could be a headache, GI symptoms, mood changes, brain fog, or skin rashes. It is sometimes difficult to figure it out because when you have a food sensitivity, it can take up to 3 days before you notice a symptom. So you don't always break out right away. Now, if you do have a food sensitivity, there is hope that you can at least eat some gluten on some level, but you need to work with your functional medicine provider to do an elimination diet and then a slow reintroduction phase to figure out what types of gluten foods and how much you can eat. A wheat allergy is actually a different type of immune response. This is an IgE antibody. This will happen right away. As soon as you eat wheat, your body may start to flare. Now, wheat, it triggers called a mast cell, which causes histamine release, and that's what makes you itchy, swell up. So this is something that could put you at risk for anaphylaxis. You can get tested for this. You can ask your doctor to order an IgE test for wheat, as opposed to the gluten test, which would be an IgG gluten. Now, if you do have this, then you may need to work with an allergist to try to work on some sort of desensitization protocol. If you like this video, please follow, subscribe. Have a fantastic day.